Welcome to Connect, powered by the Fulton County Department of Senior Services. I'm your host, Dr. Pamela Rochelle. This show connects you to information, services, and programs that support healthy aging. Not only is healthy aging a priority of Fulton County government and the Department of Senior Services, it is the guide by which we provide the most relevant resources to assist our aging population remain independent, healthy, and active. On today's show, we will take a look at a growing trend that poses a threat to seniors: social isolation. There are multiple forms of isolation, such as living alone, smaller social networks, limited socialization, and feelings of loneliness. We will feature free resources that connect residents to community-based services that can reduce isolation. Later in the show, you will learn about the technology advances that are here to promote healthy aging and are used by older adults to increase social connectedness and engaging activities. So stay tuned. Welcome back to Connect, powered by the Fulton County Department of Senior Services. I'm your host, Dr. Pamela Rochelle. Studies have shown that isolation increases the risk of mental and physical illness. According to the AARP Foundation, the health risks of prolonged isolation are equivalent to smoking 15 cigarettes a day. The foundation reports that 17% of American adults 65 and older are isolated. Research shows a 26% increased risk of death due to feelings of loneliness. 6 million adults 65 and older have a disability that prevents them from leaving their homes without help. And 51% of people 75 and older live alone. Although these numbers may seem alarming, various programs offered through the Department of Senior Services provide solutions and comfort to seniors facing social isolation. Fulton County operates 15 neighborhood senior centers and 4 senior multipurpose facilities that allow residents age 55 and older to participate in life enrichment classes, nutrition, and health and fitness programming, all promoting independent living and social interaction. Another program that is a great resource and connects residents or their caregivers to agencies that combat social isolation is the Starline Unit, operated through the Information and Assistance Program. I had the opportunity to sit down and talk with the Starline Program Coordinator about the services available. So today I am here at the Fulton County Starline, where you see that we have trained professionals answering your questions and providing much needed information and assistance and referrals to community resources. And so I'm joined today by the Starline Program Coordinator, Ms. Callie Williams. Thank you for joining us today.
Thank you for asking me.
Can you just tell us a little bit about the Starline and information assistance and exactly what your team provides to the residents of Fulton County?
Yes. Actually, Starline stands for Soaring Through Aging Resources, and we do everything telephonically. We refer clients to home-delivered meals, homemaker services, personal care, respite care, and transportation. But not only that, you can call us for legal assistance, housing, shopping and errands if you need it. We're just an array of information for seniors who are 60 years and older and live in Fulton County. And even though I say they have to live in Fulton County, but if you call us from another county, we're going to assist you. We're not going to just say, oh no, we can't assist you. We'll give you the information for the other county and the phone number so that you can be provided with the service.
So full assistance.
Full assistance.
It's not just the older adult. Can their family member call, or can an organization that they're affiliated with
Yes.
call you?
Most of our calls do come from caregivers or family members who are needing services for their family member, and we take those calls. Other organizations like we partner with Grady, and the Senior Services Department at Grady gives us a call. They make referrals to us too. When their clients are being discharged and they need home care like our services, they give us a call also. So we get calls from all over.
How do you really think that this helps older adults who are facing social isolation?
Well, I think because the Star line and the number is 404-613-6000.
Yes.
They call us and we're able to refer them to other resources. And some of those resources are our own Fulton County resources, like our senior centers. And we have like 15 senior centers. And a lot of clients don't even know about it. So when they call and they're asking for other resources, we ask them, well, what do you do during the day? And they discuss it, and if we feel like, okay, the senior center is good for them, then we refer them. So that way they get socialization, and they can also get a congregate meal. Eating with other people sometimes helps, because when you're isolated, you may not eat a proper meal during the day.
What's the process like? So a family member or an older adult themselves will call the 404-613-6000. Can you tell us what happens when they make that phone call?
Okay, when they make the phone call, family member or the actual client, one of our staff members, as you can see, will take the call. They will ask them, usually the caller will tell us what they want. If not, we kind of like have to ask them particular questions. And they give us their demographics, and they give us their health conditions, which is very important for us because that helps us determine what services they may need.
I see.
And sometimes they may not ask for what they really need, so that's important. And once we take all the information, there's a screening process. And our services are based on the need of the client. And because of that, there's what you call a DON score, which means determination of need. So the higher that score is, the greater the need. So we refer them to ARC, who now does our screenings. And once they do our screenings on the phone, then they are placed on a waiting list for the services. But when they come off, it's based on that score. Like say if you call me today and you get a score of like 15 or 16, and somebody calls me and their score is 30. So that score is higher, which means the need is higher. So that client would actually be assessed first and come off the waiting list.
I understand. Very good. So can you talk a little bit about any particular agencies? I know you said that Grady provides some of the referrals, but can you talk a bit about agencies that actually are in your referral system that you refer out to?
Yes, we have, naturally legal aid, and we have housing that we refer. And for the isolated seniors, we kind of have organizations like there's One Good Deed, and then there's a ROSA organization that calls clients who are isolated and just give them a friendly call, which helps because if they need service, then that would be another referral for us. For the One Good Deed, the isolation, the seniors are partnered with someone for about a year. They can do errands and shopping for them and help them prepare a meal. And they go twice a week.
So they're partnered with someone that actually gets to know them, understands what their needs are, and helps them with a variety of things. So it's not just a call in that case.
No, not in that case. They actually do errands for them, shopping errands. And sometimes the client can't stand to prepare the meal, but if you have someone in the kitchen that's there with you, they may be able to sit on a stool and instruct the person how they want their meals prepared.
Nutrition is so important.
Yes, and it's very important. Nutrition is very important because it can lead to so many things if they're not, especially if you're diabetic and you're not eating correctly, then your blood sugar level drops, and then that causes a problem. And if they're isolated and they're not eating, and that happens, then if they don't have emergency contact system, then they're in the home.
Yes. Well, Ms. Williams, thank you for joining us today,
welcome.
and thanks for all that you and your team do here in Fulton County.
Thank you.
To connect with Starline, call 404-613-6000. Coming up, innovations in technology that support healthy aging. We'll be right back. Welcome back to Connect, powered by the Fulton County Department of Senior Services. I'm Dr. Rochelle. We're so glad you're joining us today. Seniors can experience social isolation after retirement or the loss of a spouse or other family members. Health state, depression, and cognitive functioning are factors that can lead to social isolation. The social network decreases and access to social supports are weakened. However, technological advances are countering isolation in seniors and creating applications that can decrease this experience. I recently visited with Susan Lee and Elena Gonzalez, research scientists at Georgia Tech, to learn how collaborative efforts and research are discovering new ways to support healthy aging. So Susan, tell our viewers about DATHA and how you serve older adults.
Sure. So DATHA stands for the Design and Technologies for Healthy Aging, and it's an initiative founded in 2009 by 3 faculty members here at Georgia Tech who are leading experts in the use of design and technologies for healthy aging. And over the years, they've come to really strongly believe that developing effective design and technology solutions for the aging population that are also sustainable, it requires a multidisciplinary effort. And what that means is that it requires experts from a variety of different disciplines, including research, expertise from academic professionals, industry professionals, government professionals, service providers, and of course the older adults themselves. So DATHA was born out of this need for all these different individuals with a variety of different backgrounds to come together under a single entity and discuss new and exciting design technology opportunities, learn from another, and most importantly, form relationships and partnerships that would further their work and which ultimately lead to all of us being able to serve the older adults more effectively in our various capacities.
So can you talk a little more about how technology can help older adults living in isolated environments?
Sure. So technology isn't always the perfect solution for all cases addressing social isolation, but they have been effectively used, especially in cases when older adults are geographically distanced from their family members and friends and their social networks. So with the advancement of communication technologies such as Skype, email, and to an extent even Facebook, that have really facilitated the older adults' ability to stay in touch with the people that matter to them.
One of the main calls that we get every day in our department is related to transportation barriers. Can technology assist with transportation barriers as well?
Yes, for sure. That's another benefit of the technology in addressing the social needs of older adults, because older adults may be socially isolated because they lack reliable transportation to get to a place, or they might have some other functional limitations that may prevent them from going out in the community as easily as they once used to. There are researchers and other ongoing projects that are looking at developing technology specifically for those purposes.
So can you also tell us about the initiatives that you're working on and how it's helping older adults deal with isolation?
Absolutely. So I'm actually the project coordinator of TechSage, and that stands for Technologies to Support People Aging with Disability. So this grant, it's a 5-year grant that's looking at how people with long-term vision, hearing, and mobility impairments are navigating challenges as they become older adults. So it's focused on a very specific population of people aging with pre-existing disability, but a lot of our development projects have great implications for older adults in general, and I think are really applicable to the senior population. One is focused on telewellness technologies, and by that, we mean technologies that can help facilitate physical engagement and activity. So we're looking at different technologies like Skype and even different telepresence robots to figure out what people think about using that means of a platform to take a physical activity class, to do exercise or Tai Chi. How can you recreate those similar benefits of an in-person exercise class and also the social engagement piece of it when you're in a rural environment, or perhaps you can't get to a senior center yourself? So we're looking at that as just kind of a basis of how can we design an intervention that really helps people engage and stay committed while also receiving some social benefits. And Susan touched on transportation, and that's one thing that we're looking at with TechSage. We have a project called Align, and it's actually like a Google Maps. So think about an application on your phone for wayfinding. But instead of just incorporating how long it's going to take to get somewhere or traffic. It thinks about all different types of accessible options. So where are the curb cuts? How long do you have in a crosswalk to get across? Is there greenery that really obstructs the sidewalk? Are these really accessible routes? So people can be aware of what are the different barriers they might encounter and how can they plan an alternate route that best fits them. So while these aren't really specifically focused on social isolation, that piece, that social component of being engaged and connecting with other people is throughout all of our projects.
Are there opportunities for older adults themselves to be a part of this work?
Absolutely. I truly believe that research doesn't have to be scary. It doesn't have to be lab mice and scientists in white coats. I think that most of our research actually takes place in the homes and communities of seniors, and I think we've broken down a lot of barriers that we don't fight. We really just want to see what different technologies are you using, what are you willing to try, and I think a big piece about new and emerging technologies is thinking about the older adult population. We're constantly looking for people who are willing to maybe step out of their comfort zone a little bit, try a new technology, give us feedback, or even just complete a single paper and pen survey. So there's a lot of different options to meet what people might be interested in. Many are paid, so you get a little check along with your participation.
DATHA is in need of seniors interested in participating in studies to advance scientific knowledge to reduce social isolation. If you are age 55 or older and are interested in participating in future studies and research, please call Elena Gonzalez at 404-385-2564. Perhaps your organization is interested in partnering with DATHA to find better solutions for seniors. If so, call Susan Lee at 404-385-2632. Thank you again to Ms. Susan Lee and DATHA for sharing this important information with us. We'll be right back after this break with closing thoughts. Thank you again for sharing your time with us today. We thought it was important to introduce you to referral programs and services that support seniors facing social isolation. We hope you've enjoyed learning about the advances in technology that also combat this growing trend among older adults. It is our mission to improve the quality of life for older adults through the development and coordination of programs and supportive services that encourage independence and enhance the overall well-being for seniors, their caregivers, and the community we serve. All partners featured today help us achieve our mission and aid Fulton County to support healthy aging. We welcome your feedback and the opportunity to speak with you further about our services. For more information about these programs and our department, please contact us at 404-613-6000 or email us at seniorservices@fultoncountyga.gov. You may also follow us on Twitter at Fulton Info. Thank you for watching. We'll see you next time on Connect, powered by the Department of Senior Services.